everyone, today's video we are going over tests that you can do at home to try to figure out what might be going on with your groin pain. Groin pain that we're talking about today is the area of the crease of the hip here that you can kind of pinch with your hand if you were to bring your knee towards your chest. So anywhere within this vicinity, pinchy pain, achy pain, feels sore, feels like your hip flexor's on fire or overworking or weak, hurts to put your shoes on, hurts to squat, things of that sort is what we're going over today. So tests that you can do from home and what those might mean for you. My name is Dawn. I work at Performance Place Sports Care, just one part of the locally world famous chiropractors here in Costa Mesa. And if you guys like this video, feel free to visit our channel, type in groin pain. There's an exhausting amount of stuff on there for you to take advantage of. All right, so we're gonna get right into it. I'm just really gonna cover the top 3 things that we see in this office for causes of groin pain. First one, hip impingement. Second one, hip flexor. Third one, spinal referred pain. So stick around and we can figure out which one might be you. So I'm just going to get on the floor here and we're going to go over hip flexor first. The hip flexor is the muscle that comes from the spine down and attaches to the top of the hip here and is responsible for bringing your hip into hip flexion like so. So it's really truly simple. If you were to just bring your leg up actively using the hip flexor muscle here and holding, or even giving it a little bit of pressure if I were to try to push my knee away from me here, if that recreates discomfort in your groin, you might have a little bit of a hip flexor issue going on here. So truly simple, just actively bringing the knee into flexion and pushing. Does that recreate your discomfort? You might have an overactive hip flexor going on, and working on other areas around the hip girdle to offload that structure might be really, really beneficial for you, or possibly some core exercises. Second thing we're going to get into is the hip impingement. So hip impingement, we want to not actively bring our leg up, but passively. I don't want to use my hip flexor. I want to pull my knee into my chest and seeing if at any point I feel my chief complaint, my pinchy groin, okay? Or even a little bit, I'll show you from this view, a little bit into the chest and across the body, like so. Does any of that recreate your discomfort? You can keep your foot here, maybe pull it outward like so, and seeing if any of this creates your groin pain. The thing about this one is if it does, you're not actively using your hip flexor, you're bringing your joints, okay, the femur and the pelvis into a closer position. You're hitting bone on bone at a certain point, and if it's recreating your discomfort, you might have some sensitivity to that joint, to those structures. Hip impingement comes in different severities, and we're not going to get into that in this video today, but it's really one way that you can test from home if that's what's going on with you. One other thing that I want to add to that, that can be kind of fun, is when we find our pain, oop, yep, there it is right there, seeing if a little stiffening of the belly, like somebody's about to punch you, or a little sit-up test, takes your pain away. Try that right now. If this is you, you're the person who's got the pinchy groin pain by pulling it into your chest, does sitting up like so change your pain at all? If it does, that might cue us in on some pelvic and spinal positions in rehab that might help you. And again, if you guys want to know a little bit more about that, there might be a webinar that pops up on the video right now. It's a free webinar. Take advantage of it. It's there for you to teach you a little bit more about hip and groin pain and some exercises that you can do for it if this is the category that you're falling into, even hip flexor too. All right, lastly is spinal referred pain. What the heck is that? So this is something we actually see a lot of in the office. And when somebody's gone to PT, gone to rehab, tried a bunch of things, tried stretching their hip flexor, and their groin pain is just not going away, too many times do we see that they're focusing on the pain like this and not zooming out and looking at the whole body. So what is spinal referred pain? It's basically nerves that come out of the, not low back, but a little bit of a higher low back here, okay? They wrap around like so, and they go down into the groin here. So levels of L1, L2, there's small little branches that come off of those nerves, ilioinguinal, genitofemoral. We don't need to get into super duper details here, but those nerves go right into the groin here. So how do we test those? How do we know that that's going on? Well, basically what I'm going to have you do is I want you to choose something that maybe creates your discomfort. A lot of times people squatting, boom, oof, yep, there it is, there's my groin pain. Maybe you on the floor, if you thought you were the impingement person bringing your knee into your chest, gotcha. Retest that right now, and we're going to try something to see if it helps. So we're going to start at the low back here, and we're going to grab skin, and we're going to wiggle. And we're going to grab a little below that, and we're going to wiggle. And we're going to grab above, and we're going to wiggle. And we're going to work our way around. We're going to follow those nerves. We're going to grab here, and we're going to wiggle. And I want you to spend more time on this than I am. Just for video purposes, I'm showing you the spots to pull on. But I want you to spend about 1 to 2 minutes pulling in these areas. And then we're going to come to the front side here. There's a pointy bone on the front of the hip. Grab right inside that and wiggle the skin there in different directions. And then grab right into where your groin pain is. Grab the skin there, wiggle, wiggle, wiggle. Go back to your squat. Did that change anything? Go back to your hip flexor test. Did that change anything? Go back to your hip impingement test. Did that change anything? If it did, you are likely falling into the category of it's not your hip, it might be your spine. And doing something to optimize the relationship between the two and how they move may be really beneficial for you. So those are just 3 quick tests that you can do from home for hip flexor, hip impingement, and spinal referred pain. These are the top 3 things that we see cause groin pain in this office. There are a lot of other things that can cause groin pain, so it's super duper important for you to just go see somebody and get some help. If you would like for us to help guide you in the right direction, we can do that virtually or in person. Give us a call, shoot us an email. We'd love to talk to you and help guide you in the right direction. Go on our channel, like and subscribe, type in groin pain. There's so many videos for you to take advantage of. Talk to you soon.